Karen, and today we're going to be talking about mouth and teeth anatomy. So this is coming from Miguel de Cervantes, and he says every tooth in a man's head is more valuable than a diamond.
I would agree.
Yeah, pretty hard to find another diamond out there in your mouth. 6% of adult Canadians no longer have any natural teeth, and that's coming from Canadian Health Measures. That's actually sad when you think about it. I mean, so kind of a low number, but I wonder if that number changed.
That means that all their teeth are gone. That's
everything.
Tough.
Yeah, that would be really tough. So I don't know if you have a story or something of. You have lots of great stories about. You have that miracle story that you were talking about in the last video, just about teeth and teeth anatomy.
Yeah, teeth anatomy. Actually, what comes to mind is just when I was in dental school, they would teach us how to build teeth.
Oh.
Okay, so to understand, why teeth are shaped the way they are, why they're designed the way they are. So we actually had to take, make teeth out of wax. Okay, so we would have different colors, so red, green, blue, and so it's like a step by step. You go in, you put the red, and you go on there, and then you take the blue, and you go on there, and then take the green, and then step by step by step. So in the end, it would actually lead to making your tooth exactly like a tooth. I was in the end result, I was like, wow, that's cool. I will have to say again, not to toot my own horn, but I am going to toot my own horn. My first wax up, we call it, where we had to make a tooth, I got 100%. I got the best mark in the class.
Congrats.
But that was it was really cool to see how the different wax and just seeing the colors, because it makes you see the different angles of a tooth.
Oh wow, interesting. I knew you'd have a great story. So what are incisors? Did I say that right?
Mm-hmm.
And what are they used for?
Hey, well, incisors are basically some people say the front 6 teeth.
Oh, okay.
I like to say anterior incisors. I basically think of the 4 teeth on top and 4 teeth on the bottom. They're meant for biting into food.
Yeah.
Okay. I know some friends, they had braces done, and basically, long story short, their teeth, instead of biting like this, they bite like this. So they have what we call an open bite. And so one of my friends says, when I bite into a sandwich, he goes, and then he pulls, the bread comes off, but the meat stays in there.
Oh, that's frustrating.
So incisors are meant to bite into, various foods, right?
Yeah.
And so the other thing too is that they also help with protecting your teeth. Okay, so people are like, oh, what does that mean? Incisors, when you glide your teeth forward, okay, we call it anterior guidance. Your front teeth are designed in a way and positioned in a way so that they glide, so they separate your back teeth so you don't wear your teeth down in the back.
Okay, so what are canines and what are they used for?
Canines, canines are dogs.
Yeah, I was going to say
yeah.
that.
And so when we talk about canines, we talk about these teeth over here, the pointy ones.
Kind of fang.
Kind of like fangs. Yeah. If you think of Dracula, his canines are the pointy ones that he, bit into people. But those canines there, those ones are basically we call them the cornerstone of your teeth. They have the longest roots. Okay, so getting back to the front teeth, they're meant for what we call anterior guidance. Okay, the canine teeth having long roots. When you glide your teeth, some people we have when you grind side to side, they have what we call canine guidance. That means your teeth, as you slide to the right, it hits your canine tooth, and your canines slide along each other, which separates your back teeth and separate your front teeth, so you don't wear them down.
Oh,
Okay.
All right. Tell us about premolars.
Premolars are basically the ones just behind the canines and just before the molars, the big boys. Okay.
I'm feeling my teeth as you're telling me.
Yeah.
Got it.
Premolars, I can't say too much. They're basically just there for the show, and they kind of help.
Fill it out. Yeah. And help with all the chewing. So what is a crown? I missed one. Sorry. What are molars and what's their role? Sorry.
Well, you have a couple molars. Actually, your wisdom tooth is actually a molar. Okay. We call it your third molar. Okay. So you have 3 molars, first, second, and third. They're meant for doing the main part of chewing. Okay, your first molar, that's about 65 to 70% of all your chewing. It does most of your chewing.
Oh.
So I do tell my patients, hey, this is an important tooth in terms of eating. You know, if you had a tooth pulled out on this side, a molar tooth pulled out, you're gonna notice, oh, I can't eat very well. They tend to start chewing just on one side.
Yeah.
Okay.
Okay.
So, yeah.
All right. So here's the question: what is a crown?
A crown is basically a porcelain or a metal. We use composition of gold and different alloys to make a cap that goes over the tooth. Basically replicates a tooth.
Yeah.
The reason for that is when a tooth is it's broken or it's just so much filling or it's just deteriorated. Having a crown on there will just replicate the tooth, and it covers the tooth to protect it.
Mm-hmm. Okay. So you can keep it longer.
Mm-hmm.
So where is the gum line located?
The gum line located. I'm like trying to think of what that really means, but to be more actually, I know how to answer that. So most people are like, yeah, your gums are by your teeth.
Yeah.
No, your gums are a reflection of your bone.
Oh wow.
To a degree.
Yeah.
Okay. With healthy people, your gums usually are anywhere from 3 to 5 millimeters above the bone. Okay. So you've heard the terminology recession.
Yeah.
A lot of people say, oh, my gums are pulling away from my teeth. Okay. It's because when the gums pull away, it's because actually the bone has started to shrink away from the tooth. And so when that happens, it's supporting the gums, and the gums start to pull away. So the gums are basically usually a reflection of the bone surrounding the teeth. So about 3 to 5 millimeters.
And with a little, hopefully, if you're healthy, a little bit of an overlap.
Mm-hmm.
Yeah.
Yeah. Now some people, so now to a more concerning issue is when people have bone loss or bone disease. There are people that have bone disease. Their gums look okay, but their bone is way below what it's supposed to be, and so it's very deceiving. People look and they smile in the mirror. It's like, oh, my gums look great. I look healthy.
Yeah.
My smile looks healthy, but no, underneath the bone is not very good, and eventually the teeth will get loose. So
Nothing to hold them in. So what is the role of the roots of our teeth?
the role of the roots is to support the teeth. Okay, it's like the foundation. It's that big post that goes into the ground. Okay, so holding things in place. I've seen people that had nice long roots, and after getting trauma, I'm gonna use forces. Okay, if you have too much force on a tooth, it actually can start to cause the root to resort or to shrink.
Oh.
Okay, I'm not going to go into too much details, but I've seen a patient where, age 11, they have nice long roots, probably 2.5 centimeters. And then after some treatment that they had gotten done, their roots were about half the size, right? So less than 1.5 centimeters. And so when you have short roots, there's more risk of losing those teeth.
Yeah.
Mm-hmm.
And what is the enamel?
Enamel. Okay, so we're coming to anatomy. So enamel is the parts that you see. Okay, the enamel, the outside of the teeth. So it's the first layer of tooth. It's I was gonna say foundation. No, it's the outer layer. It's like the shell.
Surface.
Okay, it's the shell, and so enamel, I simply relate it to like your bone. Okay, so enamel is actually stronger than bone. Okay, and so it's more resistant, and that's what it prevents it from getting cavities seeping in.
Right.
Adult teeth have thicker enamel compared to kids' teeth. That's why sometimes we got patients that have kids' teeth left and they're 35, 40 years old. We do warn them that there's more risk of getting cavities on those teeth.
Wow. Okay, so what is dentin?
Yeah. So the outer layer is enamel. The inner layer is dentin. Okay. I show it on an X-ray. I always tell my patients, say, when you look at the X-ray and you see the outer white layer, that's the enamel. You see the inner gray layer, that's the dentin. Okay. And then you see the black inside, that's where the nerve is, right? When you have to do a root canal or something like that. So the nerve, we call it the pulp, holds the nerve and blood vessels and things like that. So the dentin is softer than your bone. Okay, I said before, your enamel is stronger than your bone, theoretically, and dentin is actually weaker than your bone, like bone in your arms, okay, because of the composition. So dentin, it's more likely of getting cavities. So we talk to patients, this is something for you all to understand. There's something called incipient cavities, okay? In a dental, in a simple terminology, it's a reversible cavity. So if you have a cavity starting inside the enamel layer, it's okay. We can keep an eye on it, brush, floss, take care of it. It can sometimes reverse. The tooth can actually regenerate the calcium and not need to be fixed. Once that cavity gets into the dentin layer, then you have to fix it. Then you have to go in and remove the cavity and put a filling in.
Okay. Oh, that makes sense.
Yes.
Okay, well, thank you so much for breaking down the anatomy of teeth and the mouth. You obviously have some great stories even from your dental school days.
Mm-hmm.
And thanks for joining us today here at The Tooth Doctor on YouTube. And don't forget to like the video, subscribe to the channel, and we'll see you guys on the next video. Bye.